Today we are going to talk about rhinoplasty, known as nose job. What is rhinoplasty? It's a surgical procedure to reshape the nose. For some patients, it's about achieving a more balanced, natural appearance. For others, it's about improving breathing problems caused by septal deviation or other nasal issues. In many cases, it is both. You may be a good candidate if you are unhappy with the shape or the size of your nose, or if you have difficulty breathing throughout one nostril or both. There are two main approaches: open and closed rhinoplasty. Open rhinoplasty is performed with a small incision under your nose for better surgical exposure. Closed rhinoplasty is performed no outer incisions. Those incisions cannot be seen from out of your nose. The choice depends on the needs of your nose. After the operation, you may experience some bruising and swelling in the couples of days, but you will experience no pain and no bleeding from your nose. On the 6th or 7th day, we will remove the stitches and splints inside of your nose, and your bruising will start fading. Most of our patients can return to their daily life in about 2 weeks period totally. Swelling improves gradually in several months, but after the first month, you can start your exercises step by step again. The final result becomes visible after the first year of your surgery. The most important thing is to communicate with your surgeon during whole process. Every rhinoplasty is personalized. If you consider a rhinoplasty for you, the very best first step is consultation with your doctor. Defining your goals, telling what you want, telling what you don't want, in order to provide a common sense. Send us a message to ask your questions and learn more. Let's talk about secondary rhinoplasty, which means revision rhinoplasty. Many patients come to me after a previous nose surgery anywhere, but they are not satisfied with those results. Sometimes this is an aesthetic concern. The nose may seem asymmetric or unnatural. In other times, it's related with lack of breathing quality, like stuffy nose. Secondary rhinoplasty is more complex than the primary rhinoplasty. There may be a scar tissue or a weakened cartilage or lack of support or any other aesthetical structural deficiency. This means we have to rebuild and correct the structure, also strengthen the structure of the nose totally. Sometimes, in some cases, a cartilage has to be borrowed from ear, pinna, or sometimes rib, in order to provide the ideal procedure, ideal result. It is important to have realistic expectations. Revision rhinoplasty takes time and needs precision more than routine. If you have had rhinoplasty before and if you are still unhappy, don't lose your hope. With the right evaluation and planning, we can restore both the BT and the function of your nose. We are waiting for your comments and questions.